Good day. Welcome to my research paper on mindful staff movements boost hospital profits. The question is, how and to what extent do mindful awareness and mindful concentration programs improve hospital staff performance? The problem is, how can hospital staff deliver health to patients if they don't have health themselves? We know this because 40% of nurses meet the post-traumatic stress disorder criteria, and in 1 year, 76% of nurses experience verbal and physical abuse. And if you talk to ER nurses, that number goes up another 12%. And mindfulness programs show real promise, but they haven't been implemented yet. Poor quality care reduces hospital reimbursements is the real problem, so this can involve hospital sustainability if they don't get these quality of care scores to go up. I've used an approach of mind, health, brain, and education to resolve this problem. There's a plethora of information on mindfulness studies, but I've tried to stick with the systematic reviews and meta-analysis, and I'm using research that's within the last 3 or 4 years. In the brain imaging area, there's a great meta-analysis of 21 studies that has been analyzed by Fox and colleagues in 2014, and they found 8 brain areas consistently change with mindfulness practices. And in the education portion, we do have analyses that link decreased hospital profits with poor quality care, and we also can link improving hospital patient care with staff training. So education is the resolution to these hospital problems. In the literature review, there were only 2 articles found that had adverse effects or risk factors in them, so there's not many. And then the hospital implementation mindful programs, there was 1. They had actually implemented a program, and they instigated the program and applied it to the hospital staff, so they didn't actually find it already existing. Now, there's multiple systematic reviews, and they show positive effects for decreasing job turnover, increasing job performance, mental and physical well-being to workers. So it makes sense to start an education program to implement for hospital staff to improve their performance. So in this paper for phase 1, I used the exact program that they used in the literature because it worked successfully. But phase 2, I used the recommendations within that research to set up phase 2. Those recommendations came from the participants themselves, which were staff leaders in the hospital. And then phase 3 is based on the research findings of how to implement more interventions that are mindful. And I've also integrated the adverse effect and risk factors, address those, and iron those out with phase 3 of how we can make a really strong education program for the staff participants. In the conclusion, the answer to the research question is yes, it improves hospital staff performance, the mindful programs do. And how does it do that? Through staff well-being, patient quality care, improving that, increasing insurance reimbursements, decreasing staff mindlessness, which can be quite detrimental, decreasing staff cynicism, and decreasing staff job turnover, which is very expensive for hospitals. And the extent that these improvements can be as far-reaching as providing and ensuring hospital sustainability for the future. Possibilities: when healthcare workers improve mentally and physically, it will affect us all, not only their patients, but everyone around them. And healthcare workers, there's 12.5 million of them, and they live in almost every town in America. So we will feel the effects of improvements in their mental and physical health. And when they improve, America will improve. So I hope to see you soon. Read my paper. I'll talk to you soon.